Hi, my name is Francisco Chavez, and today I'm going to talk about vital signs for dietary supplementation to prevent cancer and heart disease. Introduction. The use of dietary supplement products is common in the United States. The National Health and Nutrition Examination Survey, conducted from 1999 through 2012, showed that more than half the adults in the United States consume dietary supplements.
A dietary supplement is a manufactured product intended to supplement the diet when taken by mouth as a pill, capsule, tablet, or liquid. A supplement can provide nutrients either extracted from food sources or synthetic, individually or in combination, in order to increase the quantity of their consumption. The class of nutrient compounds includes vitamins, minerals, fiber, fatty acids, and amino acids. Dietary supplements can also contain substances that have not been confirmed as being essential to life, but are marketed as having a beneficial biological effect, such as plant pigments or polyphenols. Animals can also be a source of supplement ingredients, as for example collagen from chickens or fish. These are also sold individually and in combination, and may be combined with nutrient ingredients. In the United States and Canada, dietary supplements are considered a subset of foods, and are regulated accordingly. The European Commission has also established harmonized rules to help ensure that food supplements are safe and properly labeled. Among other countries, the definition of dietary supplements may vary as drugs or other classes of ingredients used in supplement products. Creating an industry estimated to have a 2015 value of $37 billion, there are more than 50,000 dietary supplement products marketed just in the United States, where about 50% of the American adult population consumes dietary supplements. Multivitamins are the most commonly used product. For those who fail to consume a balanced diet, the United States National Institutes of Health states that certain supplements may have value. In the United States, it is against federal regulations for supplement manufacturers to claim that these products prevent or treat any disease. Companies are allowed to use what is referred to as structure-function wording if there is substantiation of scientific evidence for a supplement providing a potential health effect. An example would be blank helps maintain healthy joints, but the label must bear a disclaimer that the Food and Drug Administration has not evaluated the claim and that the dietary supplement product is not intended to diagnose, treat, cure, or prevent any disease, because only a drug can legally make such a claim. The FDA enforces these regulations, and also prohibits the sale of supplements and supplement ingredients that are dangerous, or supplements not made according to standardized good manufacturing practices.
Applications in medicine. The consumption of appetizers with a high content of fat and salt, or the intake of fast food with a rich composition of dietary fats and salt, is negatively associated with a higher prevalence of heart diseases, principally in the most disadvantaged socioeconomic disadvantages groups that generally consume this type of food.
One of the most common questions I get from patients are, what are some supplements I can take for cardiac protection? Now, vitamins are extremely common. Most people take vitamins, but really the data for vitamins is extremely poor, especially for cardiac health. So there's been studies looking at vitamin C and vitamin E, and they're actually not beneficial at all. In fact, there's been a study looking at vitamin E supplementation, and it actually may lead to more heart failure and stroke. So we actually actively discourage our cardiac patients from taking vitamin E. Now, vitamin C probably doesn't do anything for the heart. So we tell them if you want to take it for common cold, you can, but for heart protection, really, there is no benefit. And most people think that maybe multivitamins helpful. Actually, it's actually no benefit for cardiac protection. There has never been a vitamin that actually helps protect the heart. Now, some people say, what about vitamin D? The data on vitamin D is extremely sketchy. Now, if your vitamin D level's very, very low, there might be benefit to supplementing vitamin D. But for the rest of us, the data is not very good. So for right now, we're going to wait for the trials for vitamin D, but really there's no data to support routine use of any of these vitamins for cardiac protection. Now, there are some over-the-counter vitamins that can definitely be harmful. And we really want you to talk to your doctor before you take any supplemental vitamins. There's been some vitamins that increase heart rates because they're made out of animal thyroid. Some of them actually increase heart rate and blood pressure. So we're very careful to tell our patients, especially our heart disease patients who are on antihypertensive medicine, to please speak to us before they take anything. There's also over-the-counter cholesterol-lowering medicine. Some of them actually have had multiple FDA warning letters about causing liver damage. There are vitamins that can definitely interfere with your cardiac medicine. So there are vitamins that can increase your bleeding time, for example, cause increase in your heart rate and in your blood pressure. And that can actually lower the efficacy of some of the medicines you're taking. So it's really important to talk to your doctor about the vitamins because some of them can definitely interact with your cardiac medications, making them less beneficial or maybe increasing or potentiating the effect. We worry most about bleeding complications. So there are patients with AFib who are on Coumadin or on newer anticoagulant agent, and then they get started on a supplement, and their bleeding time greatly increases, and they come in with, profound bleeding events. So before you start any supplements, good idea to talk to your doctor about whether these supplements can harm or benefit you.
Pros and cons. Pros. Dietary guidelines continue to recommend restricting the intake of saturated fats. This recommendation follows largely from the observation that saturated fats can raise serum levels of total cholesterol. Cons. Supplementation with vitamin D3 had no effect in cases of invasive cancer or a relationship with serum vitamin D levels.
For the last 50 or 60 years, we've all been operating under this paradigm that came from the research of a doctor who basically cherry-picked a lot of his data and massaged a lot of his data to prove, in his estimation, that saturated fat and animal fat was bad for human beings. And that's actually another chapter in the book about saturated fat and how that myth got started or how that lie got started. But basically, the human body needs saturated fat, good quality fats, because as we said earlier, every cell membrane in your body has to have cholesterol to function properly. Without it, your cells won't function properly, and that can lead to disease on a cellular level. In the same respect, your brain and your nerves are made of fat. They have to have fat to function properly. Without it, you're gonna have neurological disease. And so, how can we tell somebody? How does it even make common sense to say, oh, your brain and all your cell membranes are made of the components of saturated fat, but you shouldn't eat saturated fat, it's bad for you.
Yeah, it's kind of strange. But the body can build its own saturated fats, right? So you don't necessarily have to eat it.
It can build fats, but it's much better to just eat good, natural, high-quality saturated fat.
But isn't it, I mean, I'm just playing the devil's advocate, but isn't it going to raise your cholesterol and that's going to give you heart disease, right? That's the idea.
That's a great question. So total cholesterol, we thought for decades, was a marker of an increased risk in heart attack and stroke. And so that's why so many doctors told this lie to their patient. Stop eating saturated fat or it'll give you a heart attack, right? Or if you insist on eating saturated fat, I'll have to give you this medication that'll lower your cholesterol so that you won't have a heart attack or a stroke. Doctors really don't care what your total cholesterol is. We cared about cholesterol because we thought erroneously that it was a marker for an increased risk of heart attack and stroke. And so now when you go back and you actually look at all the meaningful research that's been done, Saturated fat has nothing to do with your risk of heart attack and stroke. And so even pretending that eating saturated fat or eating cholesterol is going to increase your risk of heart attack and stroke is silly. None of the research bears it out.
Issue applied in Ecuador. In Ecuador, there are no studies of supplement dietary for the prevention of heart disease and cancer. In the Constitution, the articles talk about the duty of good nutrition and the right to health, but it doesn't guarantee a diet with supplements for catastrophic diseases.
You really want to go back to your dietitian and to your doctor with any of these questions because certain supplements are important and helpful. So some people need to take vitamin D, some people need to take probiotics. There are magnesium sometimes if your blood level is low from chemo, but there are other supplements that can actually reduce the effectiveness of your treatment. So, for example, taking high-dose antioxidant pills during radiation therapy may reduce its effectiveness. Same thing for chemo. So you don't want to be going through all of this and doing something that's inadvertently sort of compromising its success to some extent. One thing that people often are understandably confused about is, well, then I guess I shouldn't eat blueberries because those have antioxidants. And the issue and concern is just with supplements, which can be high dose, potent, and also to some extent a lack of regulation. So we don't want you skipping those fruits and veggies. We want you picking those and asking your doctor about the supplements. Don't just start taking vitamins thinking they're going to fill in the gaps.
Conclusion. Byron has now filled this knowledge gap and convincingly shown that the use of N3 fatty acids is not effective in preventing the combined endpoint of myocardial infarction, stroke, or death from cardiovascular causes in unselected patients.
Ingrid Fauché Murphy tries to stay as fit as possible. She was diagnosed with breast cancer 7 years ago. As she waited for treatment, Murphy wanted to increase her odds. So she also went to a naturopathic doctor.
And he prescribed various multitude of vitamins, which included A, B, C, D, melatonin, 20 milligrams melatonin, which is fairly high, and some other supplements like turmeric, which is antioxidant.
It was not a prescription her oncologist approved of. He worried popping vitamins would interfere with chemotherapy, a critical part of cancer treatment.
I thought I was pretty proud of myself that I was being very proactive in all of these vitamins. And he said immediately that I had to stop taking all of them.
This new study supports that advice. It followed 1,100 breast cancer patients in Canada and the US through treatment. 18% took vitamins like A, C, or E. Their risk of the cancer returning was 40% higher.
When I started this study, I really didn't think we'd see anything at all.
Just as surprising to the lead author, even non-antioxidant supplements such as vitamin B12 and iron supplements also carried a similar risk. The findings show only an association, not cause and effect, and it's a small group statistically. Still, concerns over taking vitamins during cancer treatment have been around for a while, but not all patients in the study knew that.
Probably only about half the patients had a conversation with their doctor about use of supplements.
Chemotherapy uses special drugs to destroy cells, both cancerous and normal cells, but antioxidants like vitamins A, C, E, and coenzyme Q10 help repair cell damage, and that can interfere with this process. This cancer doctor says the study deepens the understanding of the potential risks of vitamins.
Patients think that it will boost their immunity when they are on chemotherapy or radiation. We believe they counter the cytotoxicity, or in other words, the the benefit, the work, how the chemotherapy and radiation works.
Vitamin supplements can play a role in recovery after cancer treatment. As for Ingrid Fauché Murphy, her treatment's long over, and she's back to taking her vitamins. Vicadopia, CBC News, Toronto.
Thanks for your attention.